this padding underneath you so we can
What's
lift
it
you.
for?
It's to lift you, okay, sweetie?
If you just grab my hand, I can lift
How
myself
about we turn to your side? And then you have to see what side she can turn to.
We practice procedures on mannequins or on real fake patients so that we kind of get the kinks out and have a better understanding of what we're doing before we practice on real people.
Just one underneath.
Ouch.
Sometimes she's a crabby patient, sometimes she's anxious, sometimes she's scared, and she'll act like a real patient. She'll ask questions like a patient would.
What is that?
We want the staff to react to her as though she's a real patient.
Robin, we're just going to put these in between your legs, okay?
That doesn't feel very comfortable. You're going to stay with me? Please stay with me.
Yes, we will.
That's uncomfortable.
Sorry. You're all covered though, don't worry about that.
Okay.
Do you need more slack or are you good?
When you have someone responding to a real suit, like a real suit, then real emotions and real interactions can occur, because that's how we are as people. I mean, we can imagine this. You could say, oh, look, imagine me right now, I'm bleeding, and I could act. But if I see you bleeding, you know, even if I know that you're not, but the sight of it, you know, it inspires a sort of a visceral emotional reaction. And the same thing with doing this kind of training. If someone looks the part and you're trying to use this equipment that's used to lift and support very large people, you're going to have a feeling that you've done it before when you practice with this suit.
So now we have to put the bed down.
So I was looking for a girth suit because every time I tried to be the patient, people would say, Gail, it's really kind of you to be the patient, but you're not the type of patient that we're struggling with. So I tried to look for some kind of a girth suit, and there really wasn't much out on the market. There were these blow-up suits and, you know, things you add water to, and I said, yeah, great, we're going to have mold in our hospital. And it's just not practical to, you know, get the water in, get the water out, and schlep this thing around.
All right, we need to put these.
I tried to look for an artist that could help me, and Big Nazo was perfect because, you know, he was excited about the project. I think he was almost more excited than me. He said, my parents always wanted me to be a doctor, and, you know, so this is the closest I can be to being a doctor. He really paid attention to detail. He came in, he went through the training with us a little bit. We showed him what equipment we were trying to use with the patients, and he really wanted the suit to be as close to a real person as he could possibly make it.
See that effect of one fitting into the other? If that didn't happen, you'd have a lot more difficulty getting this to fit unison. You know, one size fits all. The band right here really keeps it together, and then this allows opening, but then it clamps shut again. So we like that kind of lockdown. This came about was because of our relationship with the medical community here in Rhode Island, they asked us to do the suit for them. And it's because that was presented at a conference where other folks saw it, then they saw it could be done, and then of course by default, we want to hire the people who made it. The other thing is really make sure that nothing gets underneath these fabric parts. If we didn't have that opportunity, we would never have been approached by this company. I guarantee you would have been a mold-making house somewhere in California or New York that makes, you know, basic prosthetics. It would have been much more of a rubbery Ken Barbie doll, but large version looking thing.
Is this what we're using?
The legs really forces you to walk like a heavyset person.
I think it's eye-opening for a lot of people. They have a better understanding of what the issues are that heavier people have, and it gives them a better understanding of how they can help that patient maneuver.
What do you think that a patient, any patient, thin, heavy, is going to think about that equipment when it comes into a room?
They're going to be scared. It's going to be intimidating. And
Absolutely.
they want to know what's going on.
It's one more piece, it's one more tool in your toolbox to get the point across.